Jim Duryee. I'm an ophthalmic technician. I'm an administrator for David Cook and Stan Pletcher's practice up in St. Joe, Michigan. I'm also on the board of directors for Vision Outreach International from its inception. I've been blessed to do that. I don't do much. I sit there, I take notes, and I nod a lot, and that's kind of how we get where we are. I have been blessed enough to do a fair number of short-term mission projects over the last 15, 18 years. Many with some really cool people. Wendy's somebody I've met along the way, and Dane, had a chance to work with him in Ecuador this year. So I want to talk about that whole logistical process of how you make a trip happen, because oftentimes what will happen is your surgeon will come to you and then he'll say, okay, so your doctor wants to go on a mission trip, and he'll look at you as your technician and say, make it happen. So I just want to show up on that day, and you're the one that's done all the work. So I will tell you a little bit about how we do that. I have no financial interest in any product or service described in this talk. All right, trip planning. Again, we have to shorten the talks a little bit because they're running over. So I'm going to rush through this. Please let me know if you have any questions. We'll try to stop and answer them right away. And if it gets to be too long, we'll cut that back. So we're going to talk about trip planning now. First things we need to know are the scope of the project, the facilities and personnel assessment, what's on the ground, kind of need to know that. Then you have to develop your team structure, what are you going to need to take with you, and then equipment and supplies. So the first thing is scope of the project. When Dr. Pletcher comes in and says, we're going to go on this short-term mission project, the first few questions are up here. What do I ask him? I want to know, first of all, where we're going, because that's going to dictate how much time it's going to take. Typically, when we go to Africa or Asia, we're going to take 2 weeks because of the travel issues. When we go to Central South America, if it's a little closer to home within a couple time zones, we can do it in a week. Once I know the time and the travel required, then I can get an idea of the cost of the project, just a rough idea of the cost. And then I need to know what kind of support do we have on the ground. Is there an ophthalmologist there? Is there a static clinic there? Is this a mission hospital? What's down there that I can use as a resource to help me get started? When we're in the Dominican, we have Evelyn Diaz, who has everything ready for us. We've been to places where we walk in, we have a building and a couple of people to say, this is where you do this and this is where you do that, and that's all we have. So you need to know that before you go, because it'll really change how you prepare for the project. You need to know then the number of cases that they anticipate. That's amazingly important, because that'll determine how much supplies and what you're going to have to take and the size of your team. You need to know, are they going to do just M6? Or are they going to take a phaco machine, a Laureate or something? Or is there a phaco machine on the ground that you have to use? And if there is, what kind is it? And is there tubing? And can we reuse it? So all those things have to be answered before you even start anything. Sometimes they'll go in and they're going to do muscle balance. They're going to do muscle surgeries. They have an anesthesiologist, so there's going to be some pediatrics. So you got to prepare for that. Are they going to do pterygium? Are they going to do autographs? Or are they going to do just, you're going to need tissue glue and amnio tissue. All those things need to be answered before you can start the project. The scope of the project continued. Okay, the number of surgeons available. How many surgeons are going? Dr. Pletcher is going to go, or how many more is he going to take with him? Level of experience of each surgeon. We've been doing a lot of training lately. So we'll take a talented surgeon that can produce, like Dr. Sapko's, Wendy's husband, and he can do a lot of cases, but he's teaching. So then I have to modify the number of cases we can do, because he's not going to be doing production, he's going to be doing teaching. The number of cases per day per surgeon. You have to know how many can the surgeon do. And so you ask the surgeons that are going, and they'll say, oh, I can do 20. Figure they can do 15. Right? So when they go in and say, I can do 10. No, they can do 7. So that's how you do your math when you do your scheduling. Do you have to screen? That's a biggie. If you have to screen cases, that changes the scope of the project, because you're going to spend your first couple of days just lining up your cases. If you don't have to screen, which we have the luxury of when we go to the DR or Honduras or Paraguay, that's awesome, because all those patients are done. It's a time-consuming thing. Depending on where you are, you may have to see 50 patients to get 1 cataract. Some places you can see 50 places and get 30 cataracts. It all depends. But if they're already pre-screened, man, it changes the scope of the project. If they're not, you got to figure it. Okay, so then you do a facilities and personnel assessment. You kind of determine what you're going to need then. So I need to know, I've got help on the ground. How much help do I have on the ground? Is there medical support? Is there an ophthalmologist there? Nope, just a general surgeon, or nobody there, no medical help there. When we go on a project, we always try to have local medical support, whether it's, ideally, whether it's ophthalmologist, but if it's not an ophthalmologist, then it's got to be the general surgeon in the area. We try to get the blessing of the ophthalmologist in the area so they know we're coming and we're not intruding on their territory. We need to know a little bit about the politics, the medical politics of where we're going. Not great, but we have to be respectful of what's on the ground. So is there medical support? Are there in-country workers, and what are their skill sets? Yep, there's 12 people at the hospital. Some are nurses, but nurses from Kenya are different than nurses from the United States, or different from nurses from Honduras. So what can they do? Yeah, they scrubbed an eyes, great. So you just kind of get a feel for what's there if you can. So then you assess the facilities that are available for the project. Ideally, if your host can send you a picture of the hospital or the setup, you can get a feel for, can I get 2 beds in one room? Can I get 3 beds in one room? How can we make it set up? So you assess the facilities. Can it support the targeted number of cases? You got one OR and it's a little small room. You can't get 100 cases with 2 surgeons. There's just not enough room. It's not going to work. And can it support your team? Do you have enough infrastructure on the ground to support the people you're going to be bringing? You got to determine the available equipment and its quality. Primarily sterilization, the number of surgical beds, microscopes, and A scans. Those are the key numbers that I came up with. This is an old instrument set. We were told, yep, we have a sterilizer, it works wonderful. This was a burnt, fried instrument set that melted inside an old sterilizer. That was in Honduras a few years back. So we ended up, we always try to take statums with us when we go. The statum is an awesome little piece of equipment that is incredibly fragile and sometimes incredibly frustrating. So we always take 2, because one always breaks before you start, and then one usually breaks once you've been there, right, Sam? So you, yeah, and we've been to places where we say, yeah, we got a microscope, no problem. We get there, there's no bulbs. There hasn't been a bulb. And they say, well, what kind of a microscope do you have, and does it work? Yes, it works fine. And then you find out the oculars are all messed up, or somebody's taken the eyepieces out of them. So never assume that the stuff there works when they say they have it. Okay, team housing, yeah, then you want to look at team housing, make sure that you keep your team healthy and safe. Those are the 2 key elements. Assess the transportation needs while you're in country. What are you going to need to get from the airport to the site, vice versa, from the housing area to the site. So those all are things that you as the team leader are going to have to assess and have a good handle on. So then you're going to develop or put your team together. That's key. Now, what am I going to need? Based on my assessments and the scope of the project, I want to make sure I build a team. I want to build a team that has the skill sets I need. But the key thing is, remember to keep everybody busy. There are expectations when you go on a mission trip. And you don't want someone to spend a lot of their resources to go on a short-term project. They look for, they raise funds, and they don't have something to do. They can't keep busy. So I try to, and Wendy will attest, I usually keep everybody pretty busy when we go. So you want to make sure that nobody's standing around, that you don't have too big of a team, but you have a large enough team. So the key elements as far as that you're going to need along the way are, you need someone for screening if indeed you're going to screen. We're going to need somebody to do A's and K's. That's pretty much a full-time job. At least it's a half a day every day. You're going to do pre- and post-op assessment and patient management and flow. What that means is who's going to make the patient, or get the patients changed, get the drops in, get them ready to be blocked, make sure that they get back to the operating room, make sure they've urinated before they get back to the operating room, check blood pressures, and then after the procedure they're going to make sure that the patient gets back to their family and understand the instructions for follow-up. Instrument cleaning and sterilization. You need somebody who can manage that, especially if you've got 3 operating beds, 4 operating beds going. The instruments are coming back fairly fast. You want to make sure that there's someone who can take care of the sets, make sure they're all sterilized and cleaned and ready to go, and keep those things moving. Then there's supply management. You have 3 operating rooms going, you got your supplies in duffel bags, and you want to make sure that there's someone who knows where all that stuff is and that it's inventoried well and your stores are not only secure, but it's not all just thrown around. You need scrub techs and nurses. Obviously, with the number, that will dictate by the number of surgeons that you're going to have, certainly. Circulators, what in-country support is available, and primarily interpreters. That's usually my biggest problem, is language barrier. Sam doesn't have that problem. He speaks 42 different languages and dialects. So I always like to hang with Sam because I hear this muy loco gringo when I walk in the room from him. And then general helpers. You're going to need to have just some people to move patients and teach them, and they are invaluable along the way. By the end of the week, my job is to work myself out of a job, and when you can attest, I'm usually by the end of the week, I'm not doing anything, because you try to teach people up and get them going. She would attest I don't do anything at the beginning of the week, too. So, equipment and supplies. Determine the required equipment like microscopes, cautery, A-scan, keratometer, surgical instrument sets. How many of those are you going to need? Make sure that you understand, do you have electricity, or are you going to run on solar panels? All those kind of questions have to be answered before we get started. We need to determine our supply inventory based on the number of cases and the supplies available in country. We do have some in the Dominican. We have a great resource there, and in Honduras and Paraguay when we go down there. And they often have some supplies that we can pilfer that we've left in previous trips. But most of the time, you're going to have to take 100% of everything. So I just threw this in this morning. I developed a few years back, Tom and I got together. We said, well, what are we going to need for each trip? So we developed an Excel program that you simply put in the number of cases on top, and it'll tell you exactly what you need of each supply that you're going to take. So we've broken it down by fractions, basically. We need 2 10cc syringes per case. You put in the number, it's pretty simple. But it gives us an idea of what am I going to need to take with me? What are my supply numbers based on my number of cases? And everything is based on that. So this
are these slides going to be on this thumb drive handout?
They're supposed to be.
Well, I don't have thumbs.
You know what? But now that you mention it,
I figured that.
Jerry, what I got, I make copies of my slides, and I forgot to give them to you guys. So yeah, some of the pictures aren't on there, and I added a couple since I made those. So, but this is available. If you want me to, I can send it to you. It's pretty simple. Sometimes you have to make a little adjustments in it. But I haven't used it for a number of years. I forgot I had it. So the equipment supplies, you need to obtain the necessary supplies. So where do you get them? Where do you get all those supplies, and what do you need to do? Well, nonprofit organizations, we've been using Surgical Eye Expeditions, awesome group. They are a clearinghouse, I know, for Alcon and some other things. So we just simply make sure they know where we're going, how many cases we're doing, give them plenty of time, and they've been amazing in helping us supply our short-term projects. We solicit supplies from manufacturers, humanitarian services, Alcon, AMO. Some of those are willing to give. You sometimes have to twist arms or know the right people, but you can get it done. Purchase inexpensive supplies in the United States or overseas. There's a little company that makes implants in Pennsylvania called SEMA. SEMA sells implants for anywhere from $15 to $17. They are not FDA approved, so you can't buy them here in the United States, but they're a good PMMA project or product that we take with us and use if we don't have to fill in the gaps of donating. It's isn't it CIMA? I think, Wendy. There's two guys there. They both have the same first name. And I can't remember. You never know who I'm talking to when I call them. But they also make viscoelastic, not FDA approved. It's the same as a Viscoat and Provisc. And they're only $12 or $14 a tube.
So their clientele's overseas?
I think so, yeah. You have to sign an affidavit that you're not going to use it in the United States. But that's all you have to do. And they're very helpful. They're very mission-minded people, and they often give us a discount. I'll order 40 lenses, they'll send me 50 and charge me for 30. I mean, it's just, they've been really good to us. But also overseas, we can get them from Aravind. Oralab, awesome. That's the Aravind company, Oralab. They make a high-quality product. Problem is, and Apasami is another one. We've gotten lenses from Apasami, and I think they're only $4 or $5 each. The problem is they can't always ship them in the United States, so you have to have them shipped to the site that you're going to because of the rules and regulations. I can bring them back in, but I have to get them shipped to the DR. I go to the DR, and then I bring it back to the United States. And then I can go take it on other trips. Local sales representatives, you twist the arm, of use a little leverage. The Alcon guy is always bringing us viscoelastic that he says, here, I got a dozen. And they'll give them to us over the year, and we add it up, and by the end of the year we have enough for a couple projects. You just kind of make them feel guilty too, you know. The Alcon guy said, you know, I've been looking at Allergan lately. Then they tend to do a little more. Solicit supplies from your local suppliers, hospitals or ASCs around. Our local hospitals, incredibly generous. They know the mission of our practice and how we manage things, so we get a lot of supplies that are going to outdate in a few months, and they send them our way, and we'll take them with us. Local suppliers, McKesson General Medical is another one, or Red Hat Medical, where you buy them for your ASC, or you're buying supplies for your practice. Twist their arm a little bit. Say, this is humanitarian work. It's coming out of my pocket, and you make them feel guilty, and they do really respond. We get a lot of gloves and things that way from them. And begin saving early. This is a picture of the VOI International. Actually, it's a closet in the basement of our practice. So this is the VOI supply closet. We start saving, we get donations from various groups, and we start inventorying stuff. And if Wendy called tomorrow and said her and Dan want to go on a trip, I can have 100 cases out of there tomorrow. We just kind of keep that going. It's all neat because of Denise Cabe. It's not because of Tom or I. This is our IOL cupboard and implants we keep. All right, travel and logistics. That's the next step. So you got the scope of the project, you got your project planned, you got your team built. Now you got to get them to the country, okay? So the first thing we want to do is we're going to pack the supplies and equipment. We're going to do some team travel, getting to the country. We're going to enter the country, which is not always easy, and we're going to travel to the mission site. Packing equipment supplies. Determine the required supplies and get everything out that needs to be packed before you start packing. And it took me about 20 trips before I learned this. So what we do, and I'll show you a slide later how we do it, we take all the supplies and I put them out on the table, everything I'm going to need, and it's all up here in a pile. And I know that that's it. That's all my stuff, from my instruments, my microscopes, and gauze pads, and alcohol wipes. Everything is there. And then we start packing and inventorying it as we're packing. Inventories are vital for the whole project. So inventory all your supplies and equipment and indicate the content of each parcel. I'll show you how I inventory things and how that all comes in when we get there. Spread out your supplies across several parcels when you pack. Don't put all your eggs in one basket. You got all your implants in one suitcase. That suitcase gets held up in customs or they get lost in the airlines. Project's done. So I always try to make a mental note to put the key stuff that I could do 50 or 20 or 30 cases or a day or two's worth of stuff if something doesn't show up. I'm not dead in the water. So all my blades aren't in one case, or all my implants are viscoelastic. So spread it out. Optimize your weight and size across containers. The airlines are getting real fussy lately about weights and sizes, and they charge you for everything now. I miss the good old days. So this is what I mean. This is the basement of our practice. I take everything I'm going to need, I put it all out on a table, and I'll go back and I kind of organize everything. I have my inventory list that I know what I need, make sure it's all out there, and then we have a packing day and we put it in containers. Yes, Jerry?
These Pelican cases sometimes weigh as much or more than the contents,
Yes.
plus they're expensive and bulky.
Yes.
But recently I found there's a company in Fort Worth that makes gun cases,
Oh.
Vauxhall or something, and they're very thin, light, and I've repacked stuff and gotten rid of these Pelican cases.
Yeah, I only use the Pelicans for the real delicate stuff. My back table case, some
I'm just
A
wondering,
scans.
Are there any other sources you know of, people that, I mean, these things are amazing
I know.
to carry firearms, and so they're extremely
I'd like-
rugged.
Seahorse.
Seahorse?
We've just found that one.
Okay.
The other thing is that I've been using some is polycarbonate is a material that's very light.
Yeah.
The cases usually weigh under 9 pounds,
Okay.
and but then I make my own foam padding, and
Okay,
there's
let me
different
give you the name of
densities
this
of foam.
company. 'Cause
Yeah, I'd like to have that.
Yeah, they're here in town. I was gonna go see them, but they're gonna be closed. It's called DOSKOCIL, Dosco. They're in Arlington, Texas, at 2300 East RANDOL, Randall Mill Road. And they do things for shipping pets and stuff like that, but
Okay.
they're really thin and
Good.
they do it as well as anything.
Well, yeah, no, I mean, that's good because that's always been the complaint about the Pelicans. When they went from 70 pounds that you could check to 50 pounds, you got 20 pounds
And it
in the
takes
Pelican.
people to lug them, the wheels get torn apart.
Yeah, yeah. So I did we've done over here. There's some real lightweight. This is a Samsonite case. There's a Statum in there. It's actually lighter than the box that the Statum came in, and I have the internal packing in there, and it's got wheels. Not long ago, there was a moratorium on boxes going through Kennedy Airport. You couldn't ship a box. It had to be a suitcase type container, and if it was a box, they wouldn't take it. So we ended up taking our Statum boxes, which we used to do, and we got those Samsonite cases, and they're really lightweight. They're only 9 pounds, and they're 1 pound. They're 51 pounds. So you kind of sweet talk the gal when she's weighing it, and hopefully she doesn't notice and she lets you go. This is a scale we use. It's actually a scale that when we pack, that we're in a farming area where they do a lot of fruit and vegetables, and this is to weigh fruit for shipping commercially, and it is right on to the penny, and so we weigh all our cases on that before we do. And then I developed this inventory list, and this is a program that I have. There's a whole bunch of worksheets along the bottom of this Excel sheet, so each case is marked. There's a worksheet for each case. And what I do is when we pack then everything, we write down what we're putting in case number 1, number 2. Every case is numbered. We write down everything we're putting in there. And then we have this master inventory, which tells us, I'll take this alcohol wipes. I think they're right up here. You can't see that well. I have it blown up later. But in case number 6, I have 200 of them. It's a black suitcase. And then I have another 100 in case number 11, which is one of the Pelican cases. So then I make a pivot table, and where it says alcohol wipes, it'll show me my totals. So I have this master inventory list Wendy's familiar with, and then I have this pivot table so I can look at the end of the day and say, I've got all the numbers I need for 300 cases or 150 cases or whatever we're going to be doing. And then when we pack, that'll come, or when we unpack at the site, that'll come into play also. So this is just a blown up of that same thing I showed you. It's the number. Oh, and it gives me my expiration dates. When we get into customs, it's very imperative that you have expiration dates. They like to see them on your inventory list when you present them. I've run into that more in Honduras lately. where they do check dates on the supplies I'm bringing in. So, pardon?
Mostly just medications still, right?
Medications, anything that, yeah, medication, not implants. Implants supposed to be, if they don't look at implants, hard supplies, that's a sterilization date more than anything anyway. What's your experience? Do you?
Going to Mexico, it's been, if you have everything in just a normal luggage bag,
They don't check.
they don't check.
So you take out date or not?
So I have it.
Okay. All right.
That's it.
Well, we've been searching Honduras and Nicaragua.
What I do, we go through meticulously care off the date.
I didn't hear that, Sam.
Now, you didn't hear that.
I didn't hear that.
As long as you do that, use it on that trip.
Yes.
If you have to use
Or
on
leave
that
it there.
trip, care off the date.
Yeah. Now here's that pivot table then that just shows you my totals. So I know what's in each case and where it is, and I know how many total I have. Investigate the airline rules and costs regarding the checked and oversized luggage. Some airlines are different. It used to be 70 pounds per piece of luggage, and you had 2 when you went international. Perfect. Man, no problem. Now it's 50 pounds, you get 1 in some airlines. Sometimes you get 2 if you're going international, but it's 50 pounds. Now I'm told too, we use a lot of hockey bags for the lightweight stuff, so you can really pull the volume, but they're going to start charging you oversized on hockey bags, I'm told, because of the size of them. So you really have to check with the airlines, know which airline you're flying, what are their rules. If I'm taking a team, like Wendy's team's out in California, I'm in Michigan, and I'm going and I'm packing supplies, and I'm going to meet them down there. She's got her supplies, but I've got the bulk of them. I might be going by myself with 10 cases. If I check 10 cases, I'm paying $1,500 on the airlines. You can, I understand, if you go 90 days in advance with your booking, petition the airline that you're a mission group, a nonprofit. They can give you a waiver. I've never had one. I've never done everything 90 days in advance, much to my own discredit. But be cognizant of what you're getting into before you get to the airport and be surprised. What we also do is we will ship pieces to Wendy and her team. If she's bringing 4 people and they can take 2 each and she's only got 5 pieces, then I'll ship her some UPS, and then it's coming in from various parts around the country, and it's less likely that we're going to lose everything. So but you have to weigh the cost. You have to weigh your cost of shipping to Wendy versus the cost of what you're going to pay at the airport at the airlines. Sometimes if you look real innocent and pouty, they'll let you go, or they'll give you 2, and it's exponential. And it what they'll do is I had to check 3 just recently to the DR. I had to check 3. So in the United States, the first one was $50 more or something like that, and the next one was $120 more. So it was $170 to take those 2 extra pieces, but it cost me $35 to send it to Wendy. So it makes more sense to do it that way. Use luggage that you can fit in larger pieces to bring it back. So we want to always bring back as many as we can, because we send them out 3-4 times a year, 5 times a year. Weigh the cost. Okay, got that. And then there you are. Again, there's that Pelican that weighs so much. And you notice Jeff Taylor, you'll meet him out there. He's not doing anything. Mention that you saw a sign of him. He's the bald guy, the little guy. And just tell him, I saw a slide where you weren't doing anything.
In your hand.
Yeah. So team travel. Here we go. Gather basic information from your team before you go, so you know their passport numbers, their beneficiaries, emergency contact, vaccinations. As a VOI, as a sending organization, we need to know all that and have that on record, so there's somebody here in the States when we're traveling who we can contact if there's any issues. And the more information we have on those who are traveling with us, the better. Verify the passport is current. It's got to be 6 months before it expires, even though, I don't know, the rule is you can't go unless it's 6.
Contribute. I just applied for, there's a thing in the State Department that you can get a card, looks like a driver's license, a GO program.
Mm-hmm.
And place of standing in all that line.
Right, gets you through.
Just walk right through.
Yeah, I can't remember the name of it, but,
GOES, and I
okay.
was in Mexico last week, and one person had that, and the rest of us were lined up. The lady just walked through.
Right. Yeah, Heather Palmer has it, and
It
she,
costs $100, and you have to be interviewed.
yeah, she had to fill out a fair application. But she has that, and it gets you through customs easy too.
Yes.
Yeah, it's everything. That's a great point, especially if you're going to travel a lot. I would, and again, it's my own fault I haven't applied for that. Verify the passport. Is the visa required to enter the country that you're going to? We've had people go down to Paraguay and have to be turned around and come right back because they didn't have the visa. You don't buy it in country. You had to have it beforehand. So you had to send it to a visa company or to the consulate or embassy to have the visa before you got down there. We had a person who worked in our practice who had a Zambian passport, and she got as far as immigration in the Dominican. They wouldn't allow her in the country, and they put her on a plane and sent her home. She never did step foot in the Dominican. That was a couple years back. So you got to know the rules. Investigate State Department travel warnings for the country that you're going to be heading to. You should also check the CDC sites for recommended travel to that particular country. Schedule travel for each team member, trying to minimize the number of legs. Obviously, if they got to check luggage, the more legs you have on a trip, the more you're like to lose your luggage, or it's going to get delayed, and it's not going to get to you where you want to go. Register large equipment with the U.S. Customs Service when possible. So when you come back in, they're not thinking you bought it over there and you're trying to avoid taxes. It's a little document you can fill out, but we've had trouble getting it to the customs agent, and they never know where it is when we come back. They always say you should do it, and we always say we will, and then we just walk through. Especially on your microscopes and some of the A scans or autorefractors if you're taking something that is costly. Verify in-country travel arrangements from the airport to the site, including transport to all equipment and supplies. Make sure there is adequate transportation for equipment. We've gotten to places, we all walked out, and there's 10 of us in the team and luggage galore, and there's 2 Land Rovers, and it just doesn't work. So you got to make sure that there's enough capacity to carry not only your team, but also all the equipment and their personal stuff. Trip insurance, we try to get trip insurance. Some health insurances, not many anymore, will cover you outside of a country or on a mission project, but there are some companies that specialize in just mission insurance, and we at VOI will buy mission or trip insurance for all of our members on every team. It's $5 a day per team member, something like that, and it gives you, go ahead.
The company you use, do you remember the name?
I don't, but I can get it. Denise will know. She's the one that does that. And then you can also get specific rider insurance on each piece of equipment. So we might put $5,000 on the microscopes or whatever if we want to, but that's kind of costly. And if you know where you're going, you've been there a lot, and it's close, then you not need to. But if you're going overseas, or Europe or Africa, I would. Limit your personal items to carry-on. We always tell anybody who's going with us that whatever you need, you got to put it on the plane with you because we're going to give you something to check. And get plenty of rest. That's Shannon on her way to Kenya. So entering the country. Immigration and customs forms are usually completed on the plane. Always carry an extra copy of your passport with you or give it to another team member. We have always carry extra copies of every team member's passport. That's coming, Dr. Cook lost his passport in Honduras the day we were leaving to head back home. It was a disaster, but we got him out of the country. Long story. Copy of medical or nurse's license. You need a copy of your certification. Some countries actually require the original document. We found that. Or you need to have an apostille where you go to the Secretary of State and you have it notarized and then it's approved, and they have to have a stamped and sealed document that proves you're a medical doctor or a nurse. But always take at least a copy of your license with you that's current. A letter of invitation from the Ministry of Health, that's ideal. If it comes from the Ministry of Health, it's great. If it comes from your sponsoring organization, your mission hospital that you're going to, or whatever you're going to, that's okay too. You got to have something A copy given to each member of the team as they're going to clear immigration. A letter of donation. When you get to customs, you want a letter of donation from the sending organization that says these are supplies that have been donated to the people of whatever country, fill in blank here, and are not to be used as resale or for profit. So the more official documents you have, the better they like it when you go into customs. Clear customs together whenever possible. Let one person do the talking whenever possible. Yeah, that tends to work best for me. In my hands, that's how it works. We have the inventories, we have all the outdates. We say, whatever you want, go at it. And we usually don't have any trouble getting through. And no outdated drugs. And remember, no one is above suspicion in customs. Okay, in-country travel. Okay, try and keep the team together when traveling in the country. Have a translator available at all times when you travel within the country. I'll tell you a story about Paraguay and driving and getting stopped by the military without a translator. Keep the passport handy and secure at all times. Keep track of all the equipment and supplies at all times. This is really critical. When you get to the airport, there's chaos usually, and everybody's grabbing your equipment and they want to help and they want to get tipped, and there's parcels going all over the place. Drives me nuts. So you really want to be careful that you know where all your equipment is at all times, because many times we've gotten back and a suitcase is missing and it either got stolen or left or something happened. Experience the local culture whenever possible, churches, stores, local attractions, etc. Be cautious of food and water not provided by your hosts. That's a key one. It's miserable if you don't. Be careful and always be respectful. You're a guest in their country. I got to really hurry this along so we can get going. And this is kind of what I mean. There's chaos, people grabbing the stuff in and out. Set up an operation. So now we're at the site, we're ready to roll. We've not been there before. What do we have to do? We have to evaluate the site as a whole. We have to set things up. We have to schedule our patients. We have modifications and troubleshooting then once we get everything started. So, evaluation of the site. We want to walk through as a team. Once we walk in, we see what we have, how many rooms we have, where we're going to put our pre-op, where we're going to put our instruments to clean, where's our stores going to be. We want to assess the operating room specifically. We want to determine the number of beds that we can have in each room. We want to make sure that it's easy to move the patients in and out of the OR with one bed not disturbing the other bed. We want to arrange for a common back table if possible. When you're scrubbing, Wendy will talk more about a common back table. And then circulator supplies have to be accessible when you're in the operating room. Walk through once all the areas have been determined to evaluate the flow. We do a kind of a mock walkthrough. Okay, they're going to come in here, this is where they're going to change their clothes, they're going to walk over here, and this is where they're going to sit before they go into the OR. This is where we're going to do A's and K's, this is where we're going to clean equipment, this is where we're going to put our supplies. And just try to get a general flow with everybody in tow. Arrange the supply stores such that it's easily and accessible, well organized, and in a secure area. This was a little trip we did in Nicaragua. We had 5 surgeons. There's one OR with 3 beds and one OR with 2 beds. And these are cots that we've had modified at VOI. They're higher, they're old camp cots, and then they've been reinforced underneath. And we can take those with us. They only weigh about 14 pounds, I think, each. And then the surgeon's stools are little camp stools. So that's, again, we didn't have enough OR beds. And this was outside when we were blocking. We had them lined up and down the hallway and on gurneys, and we would just block. We did 400 cases. I think Steve Anderson referenced that. This is the one we had the laureate phaco. We never took it out of the box, and we really went through a lot of cases.
Well, you said that was your patients. I thought you'd done that to your staff.
No. No. Yeah, you get 10 minutes. Yeah. The funny thing is, you see that little incubator or warming thing for newborns. When we first got started and set up, the delivery room was right next door to the operating room. It was right outside this hallway. So the first few patients that came in heard this screaming, mothers delivering. And they would hear the screaming and they thought it was people having cataract surgery. So we had to calm them down and explain things and kind of readjust. But it was kind of funny.
Deliveries, you're just delivering cataract.
Yeah, right, yeah. Yeah. So set up. Have the team members that are going to run that specific area set up their areas. Use the inventory list to identify where each item is packed. That's the one that shows where everything is and what parcel it is. Run through each specific step of each station, such as blocking. Do I have the drops, the patient gowns, the lidocaine syringes, drawing needles, injection needles, alcohol swabs? You just want to make sure that, okay, I'm going to go through this patient. I got all the stuff I need ready to go when we start cases. Scheduling. Okay, here's another thing. Scheduling. Only a few cases initially in order to evaluate and tweak the flow. So first few days first half a day, we only do half the number of cases that we would normally do or schedule. We have a simple, concise medical record. I've got a copy of what we use at VOI that we've developed over the years. We have a clearly identify each patient and implant required. We do a little timeout kind of mental thing at the circulator. If I'm circulating, I always double check names because in some countries all the names sound the same and it's hard, so we have something taped to them and we mark the eye and we want to make sure that we are doing the right patient with the right implant on the right table. Minimize your turnover time. Next patient right outside the door of the operating room. Surgeons have a uncanny ability, especially new ones, to do a case in 20 minutes and talk about it for 30 before they're ready to do the next case. And they recap right, Sam? Yeah. Every nuance of the case they just did. Come on, we got work to do. You got to keep them moving. So we turn them over as quickly as possible. Try to give them something to do so they can't think about what they just did. Increase the schedule throughout the week as the systems become more refined and streamlined and the surgeons are more comfortable, and then certainly expect the unexpected. This is the sheet we use, the surgical sheet. It's got a screening area. It's got a screening area up here. We got an A and K area here, our target implant, and then this is our surgical note area, which surgeon did it, and then we put a sticker here of the implant, and then the day one post-op, they have the information right there. I'm going to hustle, so Wendy has some time. Post-op patients, this is key. Post-op patients, from our perspective, schedule them in a block when possible, preferably the beginning of the day. Distribute the medical record to each patient before the doctor sees the patient. First thing in the morning is best when possible. OR team's setting up, we're getting everything running instruments, opening up back tables, and patients are getting ready to be blocked, so that's the best time to use your surgeons to go down and see their post-ops. Have post-op packs already made up so they can just go by and give them to each one, and limit the number of family members per patient. Give instructions only once whenever possible. So what we typically do is we line them all up. We get one family member to stand behind each patient. The technician walks ahead and takes the patches off, puts the patch on the shoulder of the eye that they did, and then they wipe the eye down, clean it up, make sure they have the right medical record. Then the surgeon follows you with a pen light, or if they're going to do a slit lamp exam, they take them one at a time and through, or a handheld slit lamp. And then they're followed by another technician or nurse who gives them a post-op pack. And then after everybody's been seen and everybody's got their post-op packs, we give instructions. One person in their language give complete instructions about each piece in the bag, each drop, how often, where the patch is, the tape, and then we only do it once. Class dismissed. Adjust and troubleshoot. Make necessary changes early in the process. Rotate the team positions when possible. It's fun to try to do somebody else's job and to teach and cross-train. We're big supporters of that. It's good to do. Have backup systems in case of a system failure. I always have at least a half a gallon or a gallon of acetone available, because if I run out of statins, when my statin breaks, the one that was working now breaks, then I have some acetone that I can keep everybody running until we can get that thing up and going again. If the power goes out, we have a 12-volt battery that run the microscopes, so we have that. If we don't have power, we got to come in with a handheld cautery, manual cautery, so we always have a couple of those disposable cauteries around as well. So those are just some things that you can keep going. Plan ahead. We were in DR when the lights kept going on and off. We had a 12-volt battery, and I saw it coming. We got a big old bus battery. Remember that thing, Wendy? That was huge. And but we ran 2 scopes off of it for half the day. Worked out good. And Sam's developed the scope that Sam and Stan are working on. Has a 12-hour battery.
12-hour, and it's this size.
I know, it's amazing.
Yeah.
You have to take a look at it. It's out here, right? They're going to use it today. Good. Okay, and Drust and troubleshoot continued. So we allow the proper break time to avoid excess stress and fatigue. Don't overwork your staff. I have to be reminded that oftentimes. After each day's surgery, have all the team members come together to assess ways we can improve the efficiency and make changes as necessary for the next day. We want to discuss the victories and we want to celebrate them. And we certainly have to allow time for devotion and time to give thanks for what we've been able to do. So on a return trip, I want to make sure that all the equipments are cleaned, that the instruments are all cleaned and sterilized and dried well. I always pack them as well as if I'm going. You have a tendency at the end of the week, you're tired and you just want to get it in there and you take off. But again, make sure that everything's cleaned and packed, and leave what you can in the country. Bring back all the containers that you can reuse. At VOI, we need to do that because we're sending 4 to 6 teams out a year. Take an inventory, if possible, on return supplies. And this is one of our return supplies. This is a goat. We were in Nigeria with Dr. McKee. We'd been there 2 weeks. We were all tired, wanted to get out of Dodge. This is where Boko Haram kidnapped those kids. It was within about 100 kilometers of this site. And this was about 7 years ago. And we were given that goat. And we had everything packed in these Land Rovers in the back. And this was a ceremony from the tribal chief. And we're partying and ready to go. Come on, come on, come on. And then we said to our host, well, we'll leave the goat for the people that need the goat. And they said, oh, no, 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 you cannot leave the goat. You must take the goat. And we had a 4-hour drive to Jos with the goat in the back of the Land Rover. And guess who had to sit in the back seat with a goat? Yeah, and we found out halfway around that the goat got carsick. Yeah, and this was our team. You could tell they were ready to go, goat and all, at that point.
Who knew goat needed drink?
Yeah, and then back home, and there's Tom, who does exactly what I do. He does it, unfortunately, somewhat better, but not as much fun. So that's our team. Good. Any questions? That was kind of quick. We're kind of tight on time, so I'm gonna. If you have any questions, see me. If you want copies of any of those inventory lists or anything, let me know, and we can get them for you.